Hello, everyone. Good evening from Kibbutz Givat Brenner in Israel. And my name is Adina Vogel Ayalon, and I am the Deputy Director of J Street in Israel. I want to thank you all for joining us today for our webinar about combating the COVID-19 pandemic in Israel, the West Bank, and Gaza. While this conversation focuses mostly on the vulnerable populations here in Israel and Palestine, my heart goes out to everyone around the world, all of you in the United States that are struggling to deal with this crazy new reality that we find ourselves in. We're very much in a challenging time of physical isolation, all of us, and we at J Street have decided to launch JStream, a new project to keep our movement connected and informed, and this webinar is part of that new project. Our goal for the conversation today is to really understand the current situation on the ground, how it impacts the lives of people living here in Israel and the Palestinian territory. And I encourage you to send us your questions throughout the webinar. At the bottom of the screen, you'll have the ability to type in questions, and we will try to address them throughout our conversation. I want to make a specific note of thanks to Physicians for Human Rights in Israel for helping us put together this call. Physicians for Human Rights in Israel is a human rights NGO, particularly focused on the right to health in Israel and the occupied Palestinian territory. We are delighted and honored to have two public health experts and epidemiology experts from Israel and from Gaza with us today, Professor Nadav Davidovitch from Ben-Gurion University and Professor Yahia Abed from Al-Quds University in Gaza. We, of course, understand how busy you both are at the moment, and I really can't thank you enough for giving us your time tonight to provide us with the insights on the public health crisis that we're facing today in Israel and Palestine. Just a few months ago, no one actually even knew that COVID-19 even existed, and now the virus has spread to almost 500,000 people around the world. It has wreaked havoc on even the best healthcare systems and completely crashed our economies. During these times of uncertainty, all of us concerned citizens are learning about how we can flatten the curve, the importance of social distancing, and turning into uncertified public health and epidemiology experts. But I would like now to turn to the actual experts to provide us with a clearer picture of the challenges that we are facing today. So I'm going to first turn to Professor Davidovitch, who is a professor that your research focuses on health policy and the legal and ethical aspects of public health, including pandemic response and health inequalities. You've also been a volunteer for Physicians for Human Rights Israel since 2002 and currently serve as on the organization's ethics committee. So Professor, I would like to ask you to just give us an understanding of how the state of this crisis compares to what we're seeing in the rest of the region and around the world. What are the particular unique challenges that Israel is facing at this time? And to talk about some of the most vulnerable segments of Israeli society, people that are most at risk or unable to receive adequate care. Are there measures that are being taken by local authorities and civil society to address the needs of these vulnerable populations?
Thank you so much, Adina, and thank you also, Professor Abed, for being with us today. First of all, I want to say that those who are involved in public health maybe were not so surprised. In the last few decades, because of globalization, climate change, migration, other different processes of changing relationship between human and animals, it was quite clear that we are going to face such a challenge. But on the other hand, I think that this makes me very frustrated, because although we knew that we are going to have a pandemic, we had some pandemics in the past, including the avian flu, later the pandemic H1N1. Unfortunately, in Israel, unlike some other countries, we didn't invest in public health infrastructure in all aspects, in terms of the healthcare workers, in terms of laboratories. And in many ways, when we entered this pandemic, it rested on existing problems in infrastructure and also on existing social and economic inequalities that are now being reflected during the epidemic. Now, we had in Israel a very detailed plan, but again, the investment was not taken. When the virus was announced and the WHO, the World Health Organization, declared the coronavirus, the COVID-19, as a public health emergency of international concern, Israel was quite fast to implement quite dramatic measures. And actually, this was a very important move because the idea of flattening the curve that you mentioned was very important. But the question was how, from a public health perspective, you are engaged not only with the epidemiological measures and social distancing, but also taking an approach of what we call health in all policies, and approaching also social and economic and political determinants of health. So at the beginning, Israel, like other countries, was preoccupied for preventing the first cases. This is a stage of prevention. Then it was a phase of containment, meaning that people were coming here from Europe and other countries, and we did lots of epidemiological investigation. Things were very, very centralized. And I think that on the epidemiological part, we gained time, but unfortunately, this was not used enough to deal with the social, mental health, community aspects. And then gradually we got into a situation where many different parts of society remained, quite in the margin. And I'm talking about the Arab community, especially the Bedouin community in the south, also those living in unrecognized villages. I'm talking about migrant workers and asylum seekers. I'm talking about prisoners. And I'm talking about other Israelis that are from lower socioeconomic group, especially the elderly that we know that are suffering from high case fatality ratio. Another group that I want to mention are, of course, the healthcare workers that are still standing in the front, and things are still ongoing. After finishing the second stage of containment, we moved now to what is called mitigation phase, and now the virus is widespread in the community. I'm not going to get into very detailed discussion about the tests that are being discussed all around the world. After lots of pressure and internal discussion within the Ministry of Health, because many people were very concerned to be centralized in order to have the gold standard test, but it was quite clear that you needed to plan ahead in order to enlarge the test as much as possible. And I'm glad that at least a few days ago, finally, we have now about several thousand tests. Now, why it's important? It's important because we can now have the epidemiological picture on the country level. We can have more tests for healthcare workers, more tests in hospitals for patients, and also for the elderly. And right now, after entering the widespread transmission phase, we are now entering into the stage of a very stringent measure of quarantine. While I support those measures, because I think it's really important to flatten the curve in order not to overwhelm healthcare system that was starved for so many years, I think that we must complement our moves with a much more dramatic economic steps. I think that Israel, after many years of reducing its debt, can now take the really more generous step of giving more social support, especially people that are now not working. And the next step that is very important and started about 2 weeks ago, and this is really beautiful, the entrance of the civic society. You talked about Physician for Human Rights, but there are many, many other societies. At Ben-Gurion University, we developed a coalition already many years ago, a coalition of different NGOs, including AJIK, a Bedouin Jewish organization that is working with the communities. Also other organizations working with the Haredi community, with immigrants, the elderly. So now it's a role not just of the government, but of the municipalities, the welfare system, and the government to think not just about the neuroepidemiological component, but to think in a broad public health perspective. And I want to say that for me, for a public health physician, we need to remember that there is a tension between two aspects of public health. One aspect that unfortunately some are promoting is framing the whole question as a question of security, police, and while we need to have some of these components, sometimes we're forgetting the other component that I think it's much more important, how to frame public health, not about us and them, protecting us from something from the outside, but thinking about public health from a human rights perspective, from an inclusive perspective. And this is, of course, bringing us to the question not only about the vulnerable groups within Israeli society, but also to think about the region. And I think that having a much more collaboration between us, the Palestinian Authority, the Palestinian brothers, Jordan, other countries, we don't have the option not to think about the local and the regional level. But unfortunately, the current structure of the power relation and all the situation of the occupation, etc., it's bringing us to a very complex situation. Now, in the past, we created several infrastructure that, like the Middle East Consortium of Infectious Disease, MESIDS. We were doing courses together, Palestinian, Israelis, Jordanian. Unfortunately, this was stopped several years ago. I think that currently it's a responsibility of the Israeli government to sit together with the counterpart from the Palestinian Authority. There were some connections, but I think that should be on a much deeper level, and to think about solidarity in this region where we're living all together, and discussing ways how to exchange information, how to bring knowledge, tests, medical facilities, and maybe this can serve as a leverage for future collaboration with mutual respect, from solidarity. So maybe just to finish this part, we're going to face now several, like 2-3 weeks, when, at least in Israel, after almost going into total self-quarantine and social distancing, we will have a much better picture where we are on this epidemiological curve. We need to complement the measures also with the social, mental health aspects, and many ways to do so. And we need to think already about exit so-called strategies, also in order for the public to see, what is ahead of us, because the trust of the people is extremely important. And finally, the question, how are we framing it as a us and them, as a security thing, or we're framing it from a social point of view, from a welfare point of view. I think this is the main challenge right now, and we need to hear much more voices, many more voices, including from the public health community, that are discussing the question of health inequalities and vulnerable groups, solidarity, and to see how we can develop innovative thinking here.
Thank you so much, Professor Davidovitch. You touched on a lot of relevant points and a lot of things that I will want to follow up on with you afterwards. But I first would like us to turn to Professor Abed and ask you, Professor Abed, to give us insight as to the state of affairs in the Palestinian territory. I would like to start with a general description of where things stand, and then focus on Gaza, which of course is quite unique. But just first to give a quick background about Professor Abed, who specializes in epidemiology and has over 40 years of experience as a medical practitioner, administrator, and educator and researcher. Has held several positions in the Ministry of Health in Gaza, several senior positions, and he is currently advising the Ministry of Health in Gaza on the corona pandemic. So I turn to you, Professor Abed, to give us a picture of what's happening right now with the Palestinian Authority in the West Bank, and then to zoom in onto the unique situation of Gaza.
Thank you, Adina. Thank you, Professor Nadav, for presenting What Do You Think? And here, before starting, just to state that all the statement I am going to say is depending on my professional background. It is not at all linked by any political issue, although still I feel that politics are affecting the situation too much. When you ask me what is going on in the Palestinian Authority, in this case, I have to remember the first class I got 30 years before at Johns Hopkins University, where Professor Gordes started to teach us the epidemiological triangle: the agent, host, and the environment. From that date, I believe in this triangle and I am working with it. If you ask me, what is the difference between Palestinian Authority and Israel and other countries in the world? I'll tell you, listen. In this triangle, we have an agent. This agent is worldwide. I'm speaking about COVID-19. This is a strange microorganism, strange virus, with long incubation period, which result in bad effect on the population more. If I speak about the host, I am speaking about variation between people in their habits, in their response, and so on. But the most important difference is in the environment. By environment, I mean the environment of work. We exposed to this virus, and the Palestinian community start to respond in the West Bank, and I appreciate their effort in this. The effort focused on isolation of Beit Lahem completely, because the story started there in Beit Lahem. And by this, Palestinians gave other countries a model of a prevention of that virus. I appreciate this. Then they start to grow in their restrictions to movement of people based on expansion of the disease. Here in Gaza, the first two cases appeared later. So we got benefit out of what's happened in the West Bank. And we started the same regulations. And in this case, I have to state that we are following one protocol in management, and we are applying each step. If you observe that there are minor differences between West Bank and Gaza, it is in the spread of the cases and our preparations which we are doing. In the Palestinian Authority, we started by home isolation, but unfortunately in some localities It was not perfect. Later on, we started to do quarantine in schools, hotels, the same experience of West Bank, exactly. Now, there is a problem. The problem is the healthcare system. We are facing major problem in healthcare system. The healthcare system in the last years were affected badly by more than one factor. One of them is Gaza siege in the last 14 years. The second factor is the tax revenue capturing, where Palestinians could not use their own resources to build their healthcare system. And the third is the cut of the assistant. And most of the attendants remember what USAID did when they stopped fund for West Bank, they stopped fund for Jerusalem hospitals, and they stopped fund for Gaza. In a project we stayed long time to prepare. When we came to implementation, they said, now there is no fund. This is the major difference between the three localities. In spite of that, still I remember when Israel was seeing around 40 cases, Palestinian Authority was speaking about 30 cases or something as that. Now, you know the difference between the two localities. High difference between the two localities. And why this? This is because, as Professor Nadav said, they are doing screening for early detection. Palestinian Authority cannot do that. Palestinian Authority have shortage in their resources that they cannot, or at least these kits are limited and they don't work by the proper way. They cannot do what they exactly want to do. Now, let me to focus on the risk group. In each country of the world, they are speaking about aged people, chronic disease, and so on. Here in Palestine, we are speaking about something else. What's about workers who are working inside Israel? Still, those are now the major risk for the West Bank, all the West Bank. And if this subject was not solved completely, there will be a major problem. Our prisoners, thousands of prisoners in Israeli jails, and their conditions, I hear through media what is going on between here or there. You asked me to specify something for Gaza. For Gaza, I am saying the following, that we have excellent staff. We don't need experts from outside. They are well trained, they can do their work, and so on. But severe shortage of equipment, diagnostic facilities, and supply. The world is hearing this without any response, without any movement. World Health Organization heard our message more than one time. I'm surprised to see WHO is sending to us limited number of kits to conduct our work here and so on. We try our best here. We know that there is no treatment for the virus. We know that there is no vaccine for the virus. We have to work in two directions. The first one is personal hygiene and environmental protection. And the second will focus on social distance among population. And we are passing gradually. As I told you in the beginning that we started one step, second step, and I imagine that within short time, I imagine that curfew will be in Gaza. To do curfew, you need to offer people their needs during curfew time, and it's not easy. More than that, there is major difference between what is going on in other countries and what's going on in the Palestinian land. I heard how much Israel allocated for this epidemic. They are speaking about 10 million shekel, around $3 million. This is not for treatment and the drug. It is for social insurance of their people. That factory which will be stopped is compensated. That worker who doesn't go to work, he is compensated, and so on. And that is not going in Gaza or West Bank. It doesn't go in the Palestinian Authority. By this, I can say these are some points, and I have to point for the last point, what steps are needed. The most urgent step we need, let me first speak about internally. We are directing ourselves towards more community engagement. We are directing ourselves to strengthen social spacing or distancing, but we are looking for two major issues. The international contribution for this. I spoke about Israel and what they did for the outbreak. Those Palestinians asked people who were responsible for the deterioration of the Palestinian health system to pay the price now. They are not giving us money, no. I am saying that they should do their job to do it. The second point, I'm saying that all the issues of Gaza siege and all the problems we are facing, international community have to find a way to end this miserable situation that people are living in this country for this year. Regarding the role of other NGOs who are working, Palestinian appreciating all the steps done by all people who are helping Palestinian. But again, by the end of my speech, I want to say that the official channels are known. We have a Minister of Health, Dr. Michaela, who is working 20 hours per day. She is familiar with all what is going on. She is excellent public health lady. We have excellent Prime Minister, Professor Ishtaya, who is working in the field, putting all his efforts in that. In Gaza, the same people, the health staff, the organization which is going, I respect because they are trying their best to save their population. These are things I am willing to explore in this meeting.
Thank you, Professor Abed. So you also covered a lot of territory and a lot of the topics that I wanted to ask you about. I would like to ask Professor Davidovitch to respond to just a couple of things that you mentioned in terms of the Palestinian workers that are working in Israel and also Palestinian prisoners in jails. And I know that also, Professor Davidovitch, you're concerned with all prisoners, but I would like to hear from you if you can touch on some of the situation regarding Palestinian workers in Israel. We had heard a very unfortunate story, obviously, in the news about a Palestinian worker who has suspected to have coronavirus symptoms and was then taken and dropped at a checkpoint. If you can talk a little bit about where the responsibility lies, if there's civil society organizations that are working specifically with those, and what are their conditions currently in Israel?
The microphone, please, for Professor.
Professor Davidovitch, you're
The
muted.
microphone, please. Yes.
Yes, now I'm on. Thank you, Professor Abed. So first of all, I want to say that Physicians for Human Rights today had their first mission to Gaza. But of course, this is just, this is not going to solve the problem, of course, but it's a way of solidarity, and it's very important for us, and it's important also for the community at large and philanthropy to be engaged, because unfortunately the situation as described need to be solved, but it's not going to be solved quite soon. I think that, Adina, your question is related to what I discussed before. What is public health? And many times, and I'm talking now even people with good intentions that are not racist, or they are not, sometimes because of the fear, they can react in a way that is very, very narrow and limited. And many times, even without intentions, we tend to take our fears and augment lots of biases. So having Palestinian prisoners, so having Palestinian workers, they are of course part of, you know, the region's society. They are humans like all of us from all sides. And so we need to be very, very sensitive that our fear from the virus will not, you know, be controlling all of what we're doing. And from an epidemiological perspective, we can think of many ways that we can react in a much more comprehensive and social-oriented way. This is true for Palestinian society, as it is true also for other vulnerable groups. I think it's first of all a question of how you are framing your reaction, and you need to be very, very careful again that all the social distancing and closing borders and all this kind of mentality will affect your reaction. I think that for your question, we need to have on many different levels a much better collaboration, both in terms of governments, even now that I know it's very difficult, but we're facing a public health emergency. And finally, viruses know no borders, so it's the best for all of us. So exchange of information, exchange of supplies, tests, materials, all of that. And again, on the personal level, there are lots of professionals that were working together before and will continue to work. I myself had quite many Palestinian PhD students that I'm in touch with them. But also on the civil society perspective, organizations such as Physicians for Human Rights and others need to work in a coalition in order not to duplicate things. And we need to bring in the global community, and especially the World Health Organization, as mentioned before, in order to help us and bridge the divides. I want to say that just about a year ago, we published a report with EcoPeace. EcoPeace is an organization working on ecological and environmental issues about the situation in Gaza and how this is going to influence also Israel. We don't have the privilege to take things just, you know, in silos. We need to work on a regional level, and I can assure you that we're going to finish this crisis, and we're going to face, you know, the current situation. We're going to face climate change. So many other challenges that we need to create the right structure and collaboration in order to work together. Again, I'm proud to be part of Physicians for Human Rights, showing solidarity and try to think how to engage with different stakeholders to improve the situation.
Thank you, Professor Davidovitch. And Professor Abed, just, you know, going back to your point about saying that you don't need, you know, experts from the outside and the incredible healthcare workers that you have in Gaza. I know obviously, you know, there is a shortage of workers, and I was just talking to your colleague this morning about his concern in terms of placing, you know, shifts of doctors in different locations and not necessarily having enough staff to cover all of his needs. One of the things that was talked about before the first 2 cases of the virus were confirmed in Gaza was the possibility of patients being sent to Israel. I'm wondering if you're aware of, or potentially also being sent to hospitals within the West Bank. Are you aware of anything that's being discussed in that manner, or any other type of regional cooperation in terms of helping to relieve the burden on the healthcare system in Gaza?
Firstly, I want to say that all healthcare systems in the world are suffering. And the same thing, the Palestinian healthcare system is suffering. I'm speaking about technical capacity of the staff. Our staff are capable to meet the cases. But we know that when Corona, I hope that it will not spread with the worst scenario, that there will be shortage. And there are shortage all over the world in this. But what I want to say here in this case, we are facing different situation in Gaza. You could imagine that the 9 cases, and I am giving this message to Professor Nadav to check and to see. For the all 9 cases we reported, there is no single clinical manifestation. No fever, no cough, no dyspnea. That means there is something in the virus itself. But at the same time, we have to be ready for all scenarios. Until this moment, there is a small hospital for isolation of positive cases, but there are plans to expand when we need it. And community involvement will offer for us other alternatives how to see. We did not reach the stage of referral outside West Bank or outside Gaza. Until this moment, we know that every country around us is suffering. Every country around us have a shortage in everything. And based on that, we are not looking to, I feel that no need for referral, and people could manage what possible they can do.
Thank you, Professor Abed. I just want to remind all of our viewers to send your questions to us so that we can pose them to our experts. I'm going to ask a question now for Professor Davidovitch, specifically about the Israeli government's response to the crisis. And there have been those that have argued that it was particularly aggressive or draconian. Are there steps that you think have gone too far, or are there other areas where you think that our government moved too slowly?
Exactly. So the policy, of course, is composed of many different aspects. There were parts that I really want to praise, like closing some part of the borders. The fact that really was very, very, I think, problematic and alerted us in the civic society was the part of, in the name of security, to infringe on privacy, to get information from cell phones. We thought that a part of not being such a great move from the epidemiological perspective, because it leads to lots of mistakes. Also the process that it was very problematic, having no government, having no parliament oversight. Other measures that were taken, such as 24 hours camera inspection of patients being isolated, also very bad for trust that again is very important for compliance. So these are parts related to privacy, but I mean, Physician for Human Rights and other civic organizations maybe are even more concerned about taking sometime measures that are very narrow, many from an epidemiological perspective that are very important, but not complementing them with social and economic measures that people that are now without salary, the elderly, again, vulnerable groups, as I mentioned, the unrecognized villages. Today, there was a petition by Physicians for Human Rights about prisoners. What are the measures taken by the prison system to protect the people, the prisoners there? On top of that, there are some more professional issues, such as maybe, enlarging the testing system, etc. So in general, it's a very complex reaction. Some parts were very important. Some others, especially those related to the social and ethical issues, we need to be very careful that in a state of emergency, we're not taking too strong measures. And for sure, in terms of the regional perspective, I think we can do much, much better.
Thank you so much, Professor Davidovitch. I have just another question from you, from one of our viewers, that would like you to elaborate on some of the existing problems of the healthcare system in Israel that predated the crisis, and how that crisis is impacting those inequities in the health system.
So Physicians for Human Rights and many other organizations, myself included in all these measures, are talking about health inequities and the privatization of the system, not investing both in hospitals, healthcare workforce, and especially nurses, by the way, but also physicians, but also the inequities from center and periphery. And when I'm saying periphery, it's both geography and also what we call the social periphery. And many of these existing gaps actually are now present in terms of the current reaction, because it's quite clear that those who are from lower socioeconomic group or those in the periphery are going to suffer most. We can see, for example, that access to testing now is much less in the periphery. Some of the vulnerable groups are less targeted, and only in the last few weeks, after a lot of pushing from the civic society, things are going much better. By the way, I think that here is the role of communities to show the resilience and act, but of course, without releasing the role of the government. So I hope that after this whole event will be over, this will be a proof how much you need to invest in the healthcare system and reducing inequalities in regular times, because when you're not doing it in regular times, this is going to affect you, of course, during emergencies, for sure. So it's an investment. And as a public health physician, I must say, unfortunately, that with all the system being less, the investment being less within the public health system, it was even worse. I'm talking about the number of public health physicians, public health nurses, all the child and maternal and child healthcare centers, privatization of school services, laboratories. All of that was just discovered by the state controller report a few days ago. I was one of the witnesses there. And unlike countries like Singapore or Taiwan, you know, that after the SARS outbreak invested in not just in planning, but also in infrastructure. Unfortunately, this was not exactly the case in Israel, and I hope this would be discussed much further after the event is over, Right now, we need to work with what we have, and I really praise my friends in the public health system now that are working, really doing epidemiological investigation, and really in a very, very hard circumstances.
Thank you so much. So I'm going to turn back to Professor Abed, and then also Professor Davidovitch, you can add on to this as well, just to give some sort of picture, Professor Abed, of just the situation on the ground in the healthcare system in the West Bank, but also in Gaza, as to having enough supplies, protective equipment, ventilators, and for the projected number of cases. I know that you mentioned that there is a severe shortage, and also in Gaza, obviously there's only 9 cases that have been confirmed, but I understand that even though there's only 9 cases that have been confirmed, obviously the assumption is that there are very many more cases. So just to give us an understanding of breakdown of where things stand in terms of supplies and equipment.
Unfortunately, that the Palestinian health system was based to develop basic service and some tertiary services. Under difficult situation, I just described in my presentation in the beginning about deterioration of the system. And because of that, if you speak about the ventilators in Gaza, you are not going to see enough number. I don't know exactly how many, but I know that the occupancy rate for those ventilators are 75%. That means already there are patients on these ventilators. Palestinians are trying to do their best to give their services, but what is worrying us that the simple things, there was severe gap in it. I'm going to tell you that, for example, the kits, and I mentioned this, we receive kits, small parts that we could not expand in our investigation for the virus as Israel did. And I respect what our people are doing. There was severe shortage in gowns and then masks, the simple thing. Still, I remember before 5 days, almost there was no masks, there was no gowns. Inside Gaza now, there are factories who are producing this material on international standard. They are working with that, they are producing it, and so on. Gaza is trying to cope in spite of all difficulties facing the population here.
Thank you, Professor Abed. Professor Davidovitch, can you also just give us sort of a picture of where things stand in terms of our supplies and equipment in Israel for the projected number of cases, and also just some numbers as well as to where we stand today?
So, of course, we are in a much better situation than what is going on in the Palestinian Authority. And that's part of the disparities or inequalities. In Israel, we are now pushing further the test. We are now doing about 5,000 per day, and the idea is to move to 10,000 per day. And these are PCR, the genetic testing, telling you the current situation. Later in few weeks, we need to enter also with serology. This is telling us the antibodies and the previous situation, because we need to think already about the exit strategies to see people that are recovered from the coronavirus illness and can go back to the community. That's something that is also very important. In terms of other equipment, we are talking also about ventilators. So Israel bought more ventilators. We are now standing about 2,500. if we're going to the radical scenario, this is not going to be enough, but we hope that with the current very, very stringent measures, the epidemiological curve will flatten, and the pace of patients coming to the emergency room is very important. In terms of protective equipment, there are lots of complaints from the healthcare workers, and this is something also that is very important in order to gain the trust, because again, as I said previously, those are standing in the first line and need to feel protected. But again, I don't want to compare the situation in Israel as in Palestine. Again, as I said, the physician for human rights are also involved, and the community need to be involved, that in all this region we have enough equipment, because that's important for all of us.
Okay, so we have about 8 minutes left. So I'm just going to take 2 more questions that I've received here and pose one to each of you. One question that I have here for you, Professor Abed, is aside from the necessary medical supplies, how critical is it to obtain relief from the blockade on Gaza? And is there any real prospect of having of that lift in light of this current situation, even in some sort of significant way?
Who did the blockade? They should remove that blockade. The blockade is affecting Gaza seriously, and it should be stopped by anyway. This is the major message I am giving. More than that, if all Gaza did not examine until now more than 200 samples, and I hear that Israel is examining 5,000 samples per day, and the same thing is happening in all the countries around. This indicator alone can tell the world how the situation in Gaza and in Palestinian Authority as general need support, need help, and I am sure that many people are hearing this message. I hope that they are going to respond.
Thank you. And a last question for Professor Davidovitch is regarding your background in ethics and asking you to speak to the balance between the privacy and contact tracing of the people that have caught COVID-19.
So when we're talking about public health ethics, we need to remember that, of course, it's based on an inherent tension between bioethics or clinical bioethics and public health ethics, because public health ethics starts from the community. Of course, autonomy and privacy are very important, but if you're thinking about classic public health measures such as vaccination, or even now social distancing and quarantine, it's clear that the first aspect is about protecting the community. I think it's very important because, again, you can go from here to solidarity. The question, again, is how you frame public health. And if it's framed too much in its compulsory measure, finally you can lose the trust of the public. So you need to keep a very important balance and go much more to the persuasion aspect and not immediately to compulsion and surveillance in a way that is kind of an overreaction. So first of all, I think that some of the measures that Israel took maybe are not even justified from an epidemiological perspective, but definitely, again, the process of taking it in such a delicate situation in terms of the political situation needed to be maybe a warning sign of not going too fast. We need to think always about the alternatives and also to see who is going to carry the burden of the policy decisions. Always alternatives and policy decisions are not distributed the same, they're distributed according to power relations. So who is going to gain, who is going to lose, that's always a question that we need to ask ourselves. And also, again, to frame the whole discussion from a solidarity point of view. I know that in the United States, sometimes solidarity sounds something like socialist. Don't be ashamed or don't be afraid to talk about solidarity. I was teaching in the United States public health ethics, and I was shocked to see how people are afraid to use even this word. Now, solidarity is not a magic bullet, because sometimes solidarity is maybe only for certain part of society. So it need to be all-inclusive kind of solidarity, social justice, and thinking how the benefit of the community will be, first of all, for the more vulnerable groups of society.
Thank you so much to both of you. We just have about 3 minutes left, so I just, Professor Abed, if you want to add any final remark, also potentially in response to the ethics question and how you deal with it, and before I close.
Okay. Many people ask us about the curfew issue. Why until this moment we did not conduct curfew? Because still the only measure in our hand, or the most effective measure, is to do curfew. It seems to me that ethical issues should be considered in this. If you put people under curfew, you have to provide them with the basic needs: food, drink, safety measures, communicable disease control, management, and so on. And I am pleased to see that inside Gaza, in spite of what is going on, today I want to give one piece of information, that UNRWA is providing excellent job in that. UNRWA made hotline for public, and they are ready to provide people with their treatment at home. They are ready to reach all non-communicable disease at home. On the hotline, they respond to people, and they can serve either through phone or to send a team to see people there at home. The same thing for social assistance. UNRWA is offering social assistance. To avoid overcrowdedness, UNRWA started to distribute those social assistance to people in their homes. And in this occasion, I want to say that it is not fair to act against a system as UNRWA, who served the population 70 years, in time where people are refugees, people are still suffering. For all the Palestinian people, they believe that the presence of UNRWA is a part of the final solution for the justice of their rights to have their nation, to have their country, to have their capital as all countries in the world.
Thank you. So we're supposed to be ending now, so I'll just say one final note of sincere thanks to both of you again for taking the time. And you know, at J Street, we are really trying not to lose sight of everything that is happening in the region, you know, despite all of the challenges that we're facing in the United States today. I really thank both of you for doing all of the incredible work that you do to ensure the safety and well-being of the most vulnerable populations here in Israel and Palestine. I really take with me your comments about solidarity and community responsibility, both in the international sense and on the local sense, as we find ourselves in times where people are perhaps adapting more isolationist perspectives and views on how to deal with public health crises. But I think both of you really highlighted the interconnected nature of this situation and how we need to be careful about how move away from the isolationist tendencies and closer to solidarity and community responsibility in the region. So thank you both so much for your time, and we at J Street will continue to be here to support the Israelis and Palestinians on the ground like you that are working hard day in and day out. So, and thank you to all of our viewers for being here and tuning in to understand sort of the challenges that we're facing here in the region.
Thank you, Adina. Thank you, Professor Nadav. Thank you for everything.
Thank you for both of you. Let's hope that we can leverage this challenge for the future. And I'm sure that we are going to end this epidemic. And there'll be lots of other things to work together, and we can indeed use it as an opportunity. Thank you so much.
Thank you.
Thank you. Good night.